Let's study about snake bites. Four common snakes that are responsible for snake bites are Indian cobra, Indian crate, Russell viper, and so-called viper. Diagnosis of snake bite is based on history of snake bite, presence of fang marks, local features such as pain and swelling at the site of bite, systemic manifestations such as spontaneous bleeding or neurotoxicity, and if the dead snake is brought for identification. So, there are 5 points that should be remembered during diagnosis. First is history of snake bite, second is presence of fang marks, third is local features such as pain and swelling at the site of bite, fourth is systemic manifestations such as spontaneous bleeding or neurotoxicity. And the last one is if the dead snake is brought for identification. What are the systemic features? Basically, these systemic features depends on the species of snake. Cardiovascular toxicity is produced by cobra and viper bites. In cardiovascular toxicity, the BP will be decreased, heart rate will also decrease, and there will be arrhythmias and pulmonary edema. They can be hemotoxic features that are produced by viper bites. There is bleeding from site of bite. There is spontaneous bleeding from gums, epistaxis, tears, intracranial bleeding, melena, hemoptysis, hematuria, conjunctival, and skin bleeds. And Drusilla also cause cerebral arterial thrombosis. Neurotoxic features are produced by cobra and crate bites. In neurotoxic features, there will be ptosis, external ophthalmoplegia, mydriasis, bulbar and respiratory paralysis. Nephrotoxicity is produced by vipers and sea snakes. There will be low back pain, hematuria, hemoglobinuria, myoglobinuria, and oliguria. Last is uremia. They can be endocrine features that are produced by Russell viper due to infarction of anterior pituitary. Lab findings: if there is hemotoxic bites, we will do 20 minutes whole blood clotting time to confirm it. How it is performed: we will take a clean, new, and dry test tube and put a venous sample in it and leave it for 20 minutes undisturbed. After 20 minutes, we will tip it to see if blood is clotted. Interpretation of this test: if there is absence of clotting, that means there is hemotoxic envenomation, there is hemotoxic bite, that is by viperine species. What is the management? So first thing is what we should do and what should not. The do's are: do it right. R for reassure patient. I for immobilize the limb which is bitten, but do not block blood supply. GH, get to hospital as soon as possible, and D, tell the doctor about symptoms like systemic symptoms such as ptosis. Do not tie tight tourniquet. Do not give electric shock. Do not give ice packs or chemicals on the site of bite. Do not suck venom. Do not use black stones. Do not use local incision or punctures or tattoos on bitten site. In immobilization of bitten limb, this retards systemic venom absorption, and if the patient walk for more than 10 minutes, then the risk factors are increased. For assessment, we will first do ABCDE, airway, breathing, circulation, disability. Then we will do clinical assessment, and then we will do special species diagnosis. If the bitten In the clinical assessment, we will first see the bitten part if it is having edema or tenderness, or there is absence of pulse or compartment syndrome. In systemic examination, we will see the spontaneous bleeding is present or not. If it is present, then any resuscitation is given as soon as possible. Neurological examination, if the patient is having ptosis, trismus, paradoxical breathing, pooling of oral secretion, or ophthalmoplegia. Some patients are unresponsive to painful stimuli and areflexia and fixed dilated pupils. In supportive care, we will give ventilation, inotropes, dialysis, blood products, debridement, asepsis, and prevention of nosocomial infection. What are the complications? Respiratory failure, acute kidney injury, compartment syndrome, tissue necrosis, bleeding from internal organs, refractory shock, secondary infection, endocrine disturbances. What is the specific management? In specific management, we will give snake antivenom. Snake antivenom is produced by more than four species we know. Snake antivenom in India is a polyvalent snake antivenom. It is produced by giving horse the four snakes venom, that is Indian cobra, Indian crate, Russell viper, and sword scale viper. When Russell viper bite, the venom present in bite is 60 mg. The polyvalent SAV constitutes 6 mg in one vial, so 8 to 10 vials are required as initial dose in Russell viper bite. Further doses depends on whole blood count, weakness and presence of serious sign, whole blood clotting time. If clotting is not present, repeat 2 doses in 1 to 2 hours of first dose. Then we will give usually snake antivenom is given as bolus. Bolus means without dilution, 1 ml per minute, and if it is diluted, it is given 5 to 10 ml per kg over 1 hour, and it is diluted in isotonic fluid. What are the side effects of snake antivenom? There are early and late side effects. Early means 10 to 1, it takes 10 to 180 minutes. There will be itching, urticaria, vomiting, diarrhea, tachycardia, and life-threatening anaphylaxis. And late complications are pyogenic reaction, serum sickness. If these are present, then we will give intramuscular epinephrine of dose 0.01 mg per kg. If it is not corrected, then we will give intravenous antihistamines like chlorpheniramine 0.2 mg per kg. We can also give IV hydrocortisone 2 mg per kg body weight. If there is systemic features, then we will give snake antivenom for several days. Snake antivenom is generally given when there is systemic features like the whole blood clotting time, the blood is not clotted, or if there is extensive local involvement. Extensive local involvement means there is severe local swelling that crosses the joint or involves more than half of bitten limb in less than 48 hours of bite in absence of tourniquet. And if the tourniquet is present and after removal of tourniquet the swelling continues in 1 hour, then also it is considered as extensive. And if the lymph nodes are also involved and they are tender and enlarged, so we give snake antivenom. Thank you for watching.